am Dr. Chandrashekhar Ponde, and I am the head of the Department of Cardiology at one of the most prestigious institutes in Mumbai called PD Hinduja National Hospital and Research Center. And I am here today to make you realize the most important mistake that you are making. Let me ask you, you listen to everyone, right? You listen to your parents, you listen to your boss, you listen to your colleagues and co-workers, but do you listen to the most important part of your body ever? Most important organ of our body is heart. Heart is the powerful pump which supplies blood to the entire body from the time you are born till you are dead without a single second of rest. And how can you afford not to listen to your heart? So today, which is a World Heart Day, I am going to teach you how to unmute your heart. And friends, let's get started by clearing off some of the most relevant and important myths that float around about cardiovascular health on social media, newspapers, and all such platforms. Oh no, not at all. Cardiovascular disease is rampant at all ages. In fact, post-COVID era, we are seeing younger and younger patients coming to us with heart attacks, strokes, very high blood pressure, and even heart failure. The cardiovascular disease affects at all ages, starting as early as even 27 years old man. You are kidding me? You meant to say I am not at risk of heart disease? I am lean and thin. My weight is 61 kgs. But yes, I am also at risk of heart disease, because risk factors of heart disease or cardiovascular disease such as high cholesterol, high blood pressure, diabetes, and phenomenal amount of psychosocial stress can affect me as well. I can be the victims of those. So no age is bar. Please remember, start taking care of your heart from as early as the age of 25. No, work stress is, in fact, in urban areas of the country such as Mumbai metro for that matter, work stress is a most important risk factor. I am running from 7:30 in the morning till 7:30 in the evening, minute by minute, hour by hour, to fulfill my commitments, right? And this creates phenomenal amount of toxins in the body. Endorphins are not released, good hormones are not released, bad hormones are released, and they all ultimately produce high blood sugar. They produce dense LDL cholesterol which penetrates into the arteries to produce blockages. Oh, I used to believe that once upon a time when I was a child. But soon it emerged that Indian staple diet is very high in carbs and high in saturated fat. Everything that we make for festivals is most often than not fried. So this is not a healthy diet at all. Healthy diet should be low carbs, low fat, high in protein, and high in fiber. No, not at all. Exercise and diet are complementary, mind you. They complement each other to maintain your cardiovascular health. During exercise, you burn calories. During exercise, you burn fats. During exercise, your blood pressure goes down. During exercise, your cholesterol comes down. And by healthy diet, you add far more to this benefits of exercise. So they are basically complementary procedures to each other. Many times symptoms of heart problems are very subtle. For example, high blood pressure is called silent killer. And many times young people particularly, let us say 25, 27, 30 years old, playing regularly football or basketball and all that, when they get little bit of chest heaviness in the middle of the game, they pass it off as gas or indigestion or acidity, something like that. That's not really true. So please pay to your symptoms produced by your heart serious attention, very serious attention, starting as early as the age of 25. I would say yes. When you have a strong family history of coronary disease, hypertension, or stroke in your family, in your brother, mother, or father getting affected with these ailments below the age of 50, you need to get very alert and get tested yourself right from the age of 30 onwards for cholesterol, blood pressure, diabetes, and weight. Oh, this myth has been circulating all over media all over the time. They say women are blessed, women are protected. Yes, they are protected up to the age of maybe 40, 43. Once menopause occurs, even women become at equal risk to men for heart issues, particularly hypertension, diabetes, cholesterol, and even heart attacks. And so, why is that? It is never too late to listen to your heart and pay attention to maintaining a healthy lifestyle. Start regular exercises, never too late. So let me conclude by saying that heart is the most important organ of your body, and cardiovascular health is the most important aspect that you need to be very alert about. Please talk to an expert to know the scientific truths about your heart health. And to know more, please visit unmuteyourheart.in.